Today in society, when we think of doctors, we think cuts and bruises. There's a doctor for the mind, called a clinical psychologist. A clinical psychologist is important because they take care of the mind and make sure that it's running regularly and there's no abnormalities. I've always been interested in helping people, especially ones with mental disorders and illnesses. And clinical psychology is something that is a field that allows me to invest myself into. The three steps of being a successful clinical psychologist are having one-on-one conversations, knowing your material, and knowing how to unwind. The first step of being a clinical psychologist is knowing how to have knowing how to have a one-on-one conversation. The first step of being able to have a one-on-one conversation is just simply starting the conversation. Ask leading questions to get the conversation going. Also, come off as a sincere friend because it allows the patient to feel more comfortable speaking. With any kind of conversation, you want to be able to listen. Listen full-heartedly and just be very open, have open body language, and then also listen for important content that might help you with diagnosis and whatnot. For example, if a patient were to mention a recent heart attack, it's important to note that according to the Depression and Bipolar Organization, an organization that specializes in bipolar depression and how its factors in treatment, 1 out of 3 heart attack survivors experience depression anytime after the attack. And I retrieved this information on October 22nd, 2014. Also, be willing to be open with your clients, meaning be willing to share experiences that you've had that might help them feel more comfortable opening up to you. Now that we identified a key trait for a clinical psychologist, time to move on to the second one. The second step of being a successful clinical psychologist is simply knowing the material. Being able to distinguish between disorders can make or break your career. Knowing exactly what symptoms are related to what disorders and which ones are similar is important. According to Beyond Blue's online website, an organization that focuses on depression and its variations, it is very important to not simply label someone as depressed, but it's important to distinguish the difference between, for say, antenatal and postnatal depression. And I accessed this information on October 22nd, 2014. There's also one thing to identify a disorder, and it's another to properly. It's one thing to identify a disorder, it's one thing to properly regulate and control it. According to the website by the UK Clinical Psychology Organization, a charity organization that helps people understand the basics of being a psychologist, a big difference between a psychologist and a therapist is that a therapist usually just has one field of psychology that they're really good at and then generally know everything else, while a clinical psychologist is well versed in everything. And I retrieved this information on October 22nd, 2014. It's also important to stay up to date because things are due to change just because of the psychology field. Everyone's testing what you do. Seeing how not every case of a disorder will be exactly the same, it's important to be well read up on different cases and not to be shocked if something isn't exactly by the book for a certain case. In the Introduction to Psychology book titled The Feeling Mind, Motivation, and Emotion by authors John T. Casipio and Laura A. Freeberg, 2 psychology professors, in Chapter 7 they bring up the eating disorders, anorexia and bulimia, which to the everyday folk can be very misinterpreted and can be commonly misunderstood. But knowing the difference between these 2 simple disorders and then more complex ones is a very good habit to get into. Now that we have an idea of the importance of one-on-one conversations and then also the importance of knowing your material, it's important to know how to just simply unwind. The third and final step of being a successful clinical psychologist is just unwinding. Being able to have a go-to hobby like running or watching the game or just anything to get your mind off work is important. Another way to de-stress from work would be just to look at the bright side of things. In her book, Living with Depression, author Laura Deborah Sereni, a practicing psychologist, talks about how she dealt with her depression and just how she just always was more positive than negative. That helped her. Being able to keep work at the office and not bring it home is important. The home should be your peaceful ground where you could just go home to your family and just be at home. It's important the home to be peaceful as possible, which will be hard with family and whatnot. But bringing the stress from work home can weigh you down like an anchor. In conclusion, the 3 steps of being a successful clinical psychologist are having one-on-one conversation skills, knowing your material, and then knowing how to unwind. It's important the clinical psychologists are important because it's important to take care of the body, but it's also, if not more important, to take care of the mind. The body is like a temple the body is like a temple where doctors take care of the outside and make it look shiny and pretty, and clinical psychologists take care of the inside, what really matters. Thank you.